Resuming debate, the honourable member for Vancouver East.
Thank you very much, Mr. Speaker. I'm very honoured today to rise in this House to speak to and to support the motion tabled by my colleague, the member from Vancouver Kingsway, a tireless advocate for not just maintaining but improving Canada's public healthcare system, and in this case, Pharmacare specifically. As he had mentioned today, New Democrats championed public health care while Liberal governments needed to be dragged forward to make any progress is nothing new. It was a former leader of the New Democratic Party that championed and pushed public health care, first in Saskatchewan and then nationally, making access to health care a basic right for Canadians for generations to come. To quote the greatest Canadian, Tommy Douglas, "I came to believe that health services ought not to have a price tag on them, and that people should be able to have whatever health services they require, irrespective of their individual capacity to pay," end quote. It is well known that universal health care dream extended well beyond where universal access to care is today, and that much more work remains to be done. I quote a former leader to highlight the New Democrat roots, our principles, and the battles that we've been fighting to improve the lives of Canadians for years. Now, I say this, Mr. Speaker, that is not only important for New Democrats, that this is actually important for all Canadians, no matter what political stripe that we're from. And I also quote them in light of the new election for the NDP, our new leader, and that is that someone who embodies these principles and who will fight this fight with love and courage. To quote our new leader, Jagmeet Singh, he said, "I believe in social democratic values, universal social programs like healthcare, but expanding them into more universal services like pharmacare and dental care," end quote. Mr. Speaker, when we're discussing the merits of expanding universal access to healthcare services, such as pharmacare, it is important to keep the following in mind. An ounce of prevention is worth a pound of cure. Prescription drugs play a vital role in Canada's healthcare system, whether that's in treatment of illnesses, the recovery from an illness, or medical intervention, or maintenance of a condition to ensure quality of life. As we have heard throughout the debate from many members, and I could unfortunately quite easily fill up my time with constituent stories as well that have brought me here, the cost of prescription drugs in Canada far too often lead to prescriptions not being filled, or simply unjust sacrifices being made to fill them. We've all met a constituent. I challenge anyone in this House to stand up and say that they have never met a constituent or a person who could not afford to buy their medication. Or challenge someone or anyone in this House to stand up and say that they haven't heard the story of someone who says, a senior most particularly, to say that they could not afford to buy this medication and that they had to cut the pills in half or skip a day in order to think that they can stretch their medication. I have even met seniors who've said to me that they were eating cat food in order that they can save the money to buy medication. The Parliamentary Budget Officer's report cited data that shows costs related to people not following their prescription regime ranged from 7 to 17% across the province. Just imagine that for a moment. How many thousands of Canadians are not taking their medication because they can't afford to do it? A 2015 Angus Reid Institute poll found that some 29% of BC households reported that they did not take medications as directed because of cost. Now, that's from my home province of British Columbia. Not taking medicine because you can't afford it, let's be clear, it is a very big deal. People die from not being able to afford medication. A 2012 study estimated that inequities in drug coverage for working-age Ontarians with diabetes could be linked to 5,000 deaths from 2002 to 2008 alone. This problem is not restricted to any one province, it's across the board, across the country. It is important to keep in mind that it has an impact on the healthcare system as well. A 2014 paper by the Canadian Centre for Policy Alternatives found that studies suggested that some 6.5% of hospital admissions are the result of people not following their medication regime. And it estimates that this represents a price tag to Canada of some $7 to $9 billion per year. For all our conservative friends who says that we can't afford to do this, I say this to you. We absolutely need to do this. What we cannot afford is not to do this and bring forward a universal Pharmacare program. An ounce of prevention is worth a pound of cure. Ensuring Canadians are able to take the prescription drugs that they need to maintain their health will have positive impacts on many areas of Canadian society, be that be increased productivity because people are healthier, or less emergency room visits, or fewer entirely preventable emergency medical interventions, just to name a few. And then not to just mention as well, of course, the very basic thing, that is, if you have a loved one, a family member, a friend who could not afford their medication, and as a result, their health is deteriorating, how would you feel about that? And worse yet, if they lost their life because of that, how would you feel about that? This is what we ran for office to do, to make that change. We can do something about it right here, right now, in this chamber, and that's what this motion is all about. According to the World Health Organization, Canada continues to remain the only high-income country with a universal healthcare system that does not provide for universal coverage of prescription drugs. What is wrong with this picture? Instead, Canada currently has over 100 private and public drug programs that's fragmented and, frankly, limits our negotiating power. My colleagues have talked about those impacts and what that means. And financially, frankly, it doesn't make any sense. It makes no sense, not for the individual, not for Canadians on the whole, and frankly, it doesn't make sense for economy. I have heard the Liberal members who try to say that somehow we can't do this because there's a study going on. Well, I'm telling you, I hope that the government can walk and chew gum at the same time. I hope that the minister has actually had the wherewithal to pick up the Parliamentary Budget Officer's report and read it and understood that what it means and send their staff to go and do the analysis around it. I hope that the minister will have the forward thinking to say that to negotiate a deal with the province and the territories is going to take more than the time that the government seems to think that it's going to take, that we need to get on with it yesterday. My colleague from Burnaby New West has said that there's been reports done on this. Even before I was born, back in 1964, there's been a report done, and successively there has been royal commissions done. How much more studies do we need? How much more evidence do we need? So I put this to the government side. Have the courage. You say you have the love in your heart, demonstrate it with the courage and vote for this motion. Let's get on with it so the gyms that is sitting there just not far from this chamber have the hope to know that the people that are representing them and people like them will have the courage and the love to act. That's what I'm calling for, Mr. Speaker.
Question.